we're leading in helping other global international organizations get involved locally and in their countries with medical education, support, and advocacy. And my job is to work with support groups and patients to get the support that they need. So that includes access to information, understanding more about therapies, access to people online if there isn't a group nearby, just basically giving people a way to get involved and a way to find others. It's really important when you're diagnosed with pulmonary hypertension. How many people, when you tell them, your friends and family, when you're diagnosed, you know, I have pulmonary hypertension, and they look at you like you're a unicorn? You know, so they just, what? And then they think it's general hypertension. So then you have to, you know, if it's difficult to talk or you know, breathing is difficult, you're like, I don't want to waste my breath explaining to you what it is, but I'm going to tell you what it is, and then by the time you're done, they're still confused because it's a complex disease. What we have at the Pulmonary Hypertension Association are a lot of resources and information, and I could go through each one of them, but I don't want to take up too much time. I'm going to highlight the best, or what I think is most important. We have, how many of you, this is your first support group meeting? Thank you so much for coming. And how many of you are familiar with the Pulmonary Hypertension Association? Oh, everybody's familiar. Okay, so I don't have to say anything. I'm just going to be done right here. Okay, so the survival guide. Who owns it? This might be your copy. So the pulmonary, and we actually have them in the office, and it's very easy to get access to them. The Pulmonary Hypertension Survival Guide. Who wants to talk about it? Anybody? When you want to talk about it?
Because there was no support, and I am a nurse, and I didn't know what it was about, and nobody I worked with is the oh, well, but you look fine. Doctors don't know what it's about. The thing I loved about that book was you get to about chapter 3, and they say, now, if you've read this far, you know more than most doctors do.
Yep. So it was written by a patient who was diagnosed in the 90s. And when she went to go find information, because the doctor didn't know, the information online and what she found were like research level information about pulmonary hypertension. She's like, this is so impossible to read. She couldn't imagine. And she's a PhD. She was a PhD, very well educated, and she was like, I just, you know, I can't. So what she did was she wrote it in her own words so that it would be accessible to everybody. There's an index, so you can look up things. Somebody throw out a topic, anything related to pH.
Flow-on.
Flow-on. So I go to F, and I look for Flow-on, and I see, it's basically an encyclopedia for pulmonary hypertension. So I go to FL, fluid, fluoxetine, Flow-on. See also epoprostenol, Velitree, Clozentan with 119. So it's like, and then there's like all the things related to Flow-on, FDA approval, emergency, cost, combination therapy, in children, characteristics. I mean, it's so much information. So, and you don't have to read the whole thing from start to finish. You can go in and just find exactly what you need to know. So this copy is the group's copy. I'm sure they can loan it out if you want to take a look at it. But it's a lifesaver, and it's the first thing we always talk about when someone's newly diagnosed. $15 for members, $25 for non-members, and if you can't afford it, you can talk to me afterwards. The other resource is the welcome brochure. So everybody got one, and what's neat about the welcome brochure is every support group is different, and when we talk, we're not going to get through every subject under the sun because we only have a limited amount of time, and there might be something that you want to learn more about. Always talk to your support group leaders to figure out maybe there's a way we can bring somebody in to talk about it specifically. But if you wanted to connect with somebody, does anybody have pH associated with something? Like scleroderma or... So you okay, so when we do the introductions, you'll hear there might not be somebody else in the room that has pH and HHT, but across the country, if you look nationally, you know, we've been organizing for 20 years. So of course, I could tell you 5 people with HHT across the country, but you might not see them in your meeting. You can find the associated conditions group online, and you can talk to people just like you with that condition. Very specific. You want to talk to a young person with pH. You want to talk to a young adult. You want to talk to a parent. You want telephone support. If this group meets twice a year, for example, you want to talk to somebody more often than that you like to chat, you can go online. All the resources are in this welcome brochure. So this is to help you in between meetings And if you want to find more, reach out more. So that's that. Emergency situations, there's a flyer here. What color is it? It's red. Oh my God. So you'll know if you want to learn more about emergency situations. We made it red so that you would know. I need to read that. Has anybody been diagnosed with PH within the last year? So if you're newly diagnosed, when you come to PHA, you can go online, you can call us. We used to do this. Oh, PHA, join. And if you're newly diagnosed, you're like, well, hey, I'm not ready to join any group. We know that, and I have a sister with PH. She's in the room. We'll do it. Hey. This is Josh, who also with PH. Anyway, so if you're new into PH, you don't want to get the song into the PHA song and dance. You want information now, and you don't want to be. We don't want to tell you to do a fundraiser. You're like, wait a second. So the envelope of hope, you just fill out the back, and you can do that right now. But you can fill it out and give it to any one of us that is here from PHA, and we'll take it back and mail you a packet. And it's specific to what you need to know, the most important information. If you want to learn more about the disease, we have a very small brochure that has medical information about it. If you want, this is a magnet, and this has 800 numbers for all the drugs, all the specialty pharmacies, and patient assistance. So that's sort of some of the resources here. Caring Voice Coalition, anybody know about the Caring Voice Coalition? It's an organization that helps with financial assistance. So with the Medicare coverage, co-pays, they work with patient assistance programs for your medication. So if you're having financial or insurance struggles, you should definitely take one of these. And then the Zebra campaign, if you guys, it's a new program that we're organizing, and it's actually not for patients, but it's for patients to tell their doctors about. And has anybody heard of the expression, a medical zebra? So, do you want to explain that? Or?
Well, isn't this what the website explains, where if you hear posts and you see stripes and it looks like a zebra and sounds like a zebra and walks like a zebra, it might actually be a zebra.
Yep. Doctors, when they hear the hoofs and they think horse, because all the symptoms of PH, throw out some symptoms.
Shortness of breath.
Fatigue. Dizzy.
Syncope, whatever. Syncope.
So all these things could be anything. And so usually it's not PH is rare. Usually they hear that and they're like, oh, it's asthma, it's allergy, let's test for everything else. But sometimes it's PH. So we're in a zoo right now because everybody in here has PH and not asthma or allergy, and maybe you do have those things. But we're asking for doctors. So patients get involved by telling the medical professionals, I am a zebra, and in case you didn't know, you should start thinking about pulmonary hypertension when you diagnose other people. And how many of you talked to a doctor, by show of hands, how many of you talked to a doctor who told you it was something else? Right? So that doctor, you might have seen a doctor and he was like, it's something else, and then you saw another doctor, and it's something else, and then you saw another doctor, and it's something else. Alex went through this like 12 times. It's something else, it's in your head, you're old, exercise. And then finally, she sees the right doctor. Well, that right doctor already knows to look for the zebra, but the doctors that kept going in front of her saying something else, they need to get the zebra. So that's our resource, that's our new campaign, and sometimes it's PH, because you don't want your experience to happen to other people. How long does it take to get diagnosed with pulmonary hypertension? The average is about 2 years. So, and some people it's way worse, and a lot of people are like, I was lucky, I was diagnosed within 2 months. Lucky, but it wasn't a drawn-out, emotionally scary, what's going on process. And sometimes it's PH is hoping to shrink that time from 2 years, from the onset of symptoms from 2 years to way less than that. So the last thing I want to tell you guys, thank you so much for listening. I'm timing myself, and I believe that I'm like 5 minutes in, which is so annoying. I wanted to do a 2-minute spiel, but that's so impossible. 10 minutes. So these, who's interested in finding a cure for pulmonary hypertension? Okay, so we are all invested in finding a cure. And I've been working at PHA for 8 years. And when I first started, it was, hope is on the horizon. It was like very obtuse language of like, yeah, it's over there. But the longer I worked at PH, the closer it seemed like we were getting to a cure, where doctors are now saying, you know what, we actually have learned so much more in this community than many disease communities. There's 7,000 rare diseases, right? And of those rare diseases, there are only 2 other diseases that have more treatments than we do. We're number 3. Tied for second? Tied for second. Josh knows more than that. So anyway, tied for second. Or maybe we're tied for third. But whatever. We're like in the top. So like we get a medal. If we're the Olympics of how many treatments are available, we get a medal. In the 90s, there was 1 treatment, and then all of a sudden we were getting all these treatments. So basically, long story short, is research is just going crazy with pulmonary hypertension. And you've seen the Susan G. Komen things, millions of dollars. We don't have that machine yet, but we kind of don't need that machine and that extensiveness because this disease has so much momentum. We're like the little engine that could. And all of this is to say for this piece of paper that I have in my hand, is that we're doing a congressional luncheon. And what does it have to do with a cure? Is that more doctors that are doing research means more likelihood one of them is going to hit it. One of them is going to find that piece, the missing link that we don't know about just yet. And we still don't know a lot about pulmonary hypertension. We need you to invite your member of Congress. And what's awesome is that you guys all live in different places. When we go around and do introductions, you can say what city you live in, and it's all going to be different. And you may all have different representatives. We want you to invite, and if you have the same, that's great. They need to hear multiple constituents. But you need to invite them to come, and then if you can, we'd like you to come. It's on a Tuesday, November 13th. But if you come and you show support, we're inviting all members of Congress, mostly their staff, come to it. They take the information, they get a free lunch, and that's kind of enticing them. But they get a free lunch, they get the information, they go back to their office, and then they talk. They're like, I just heard this unbelievable story. One year it was a woman who is an opera singer, and she was transplanted, and she was singing with somebody else's lungs. If you can imagine how incredible that story is, and her grandfather was a congressman who was our champion on the Hill. So it's an incredible story. But the people that we have talking to the members of Congress, our sort of speaker for the luncheon, they tell the most unbelievable story, and then we actually organize for you to meet with, if you have time, to meet with your member of Congress to their staff. And if you've never lobbied, it's really amazing, and there's always a staff member to go with you, so it's not so scary. You know, all these people with suits. I get scared. But we actually want to make it easy. So it's basically lunch. You hear some talks. You invite your member of Congress. All of you are invited. I hope to see you there. It's really fun. Has anybody been to a congressional luncheon event with PHA? Lucille, do you want to talk about it?
As Deb said, basically, it really is fantastic. And it does give you that opportunity to share your story because all they see is, oh yeah, another bill for research, oh whatever. But when they see that face-to-face and hear their constituent who needs this assistance and the true heartfelt story, it helps lean, thank you, it helps lean them more towards possibly giving it that more thought of it out. And I know Connolly was, I don't know if he still is, but that's my representative. It's definitely a worthwhile cause to take this action. Plus the luncheon is great. But, you know, if you can, definitely go, if you can.
Is it fun? Is it scary?
Not at all, by no means. And you also always, just like in the support groups, you get to meet other people that really share not just the pH, but the more specifics. Or you hear really, you know, when you're first diagnosed, you're really bummed out. It's like, oh my God, my world is crashing. But you see these people who 10, 20 years is still going on, and that's a big luncheon because there's so many more people there and everything. So it really is excellent. I would definitely recommend it. This will be my third one, which has RSVP, by the way. Thank you.
So that's, I appreciate you sharing because, you know, I could tell you about it and I work there, and, you know, but it's good to hear from somebody who's actually been. So anyway, does anybody have any questions? No? That's all she wrote. Thanks, guys.
Thank you.